Welcome back, everyone. A new study is raising questions when it comes to cancer treatment options. The research published in the Journal of the National Cancer Institute found patients who chose alternative therapies to treat a common, curable cancer instead of opting for the recommended medical treatment doubled their risk of death. And joining us now to discuss, we welcome our medical contributor, Dr. Kasraeian. Thanks for joining us.
Welcome.
All right, so what is considered a conventional medical treatment for cancer?
So for cancer, you know, surgery, radiation therapy, the medical oncology therapies, chemotherapy, which those things are always expanding. We've talked about immune therapies, a lot of the personalized therapies where we kind of figure out the genetic signature of your cancer, the immunological signature of your cancer, and we target therapies. All those things are becoming more and more standard therapies for cancer. What the alternative therapies are, you know, it's a wide range. You know, you can describe it as things that aren't the standard of care. They can be, you know, in some of the articles they talk about unproven cancer therapies administered by non-medical personnel. They can be things like acupuncture. They can be things like colonics. They can be, you know, I have patients
change your diet, get rid of sugar.
Things of that nature.
Juicing.
Actually, I've had patients that juicing. I've had patients that
Green
actually go to Mexico and do things like cannabis therapies and things of that nature. And with cancer, it's a very, very challenging spectrum to navigate because if you abandon what
Conventional wisdom.
Conventional wisdom has shown benefit for cancers, you know, and this particular study looked at the most common cancers in America: breast, lung, colorectal, prostate. And studies that have shown when you catch these cancers early, conventional therapies have a lot of benefit. For example, breast cancer, stage 1 breast cancer has an almost 100% 5-year cure rate. When you have stage 4 breast cancer, you have about a 20 to 25% cure rate. So if you have a curable cancer that you abandon standard therapies for something in these alternative realms, for whatever reason you decide to pursue that, and then your cancer progresses and now you have metastatic disease or lymph node metastasis or local progression, and now you have taken a curable disease and make it non-curable or less curable. What do you do then? You know, so it's a very challenging process.
But with these alternative cancer treatments, why are people picking those which have less studies and less proof of you know, working effectiveness, thank you, as opposed to conventional treatments where you can see that they work?
Well, I mean, I'll put it to the table and ask you. I mean, if someone was unfortunately diagnosed with cancer and you think about surgery, you think about radiation, you think about chemotherapy, what's some of the things that pop into your mind?
Scary, long-term results, and you can get blood
hair
diseases,
loss,
all sorts of
the veins, the vanity stuff.
I think it also comes down to money, financial.
Oh,
because as we know, it's not cheap to get any type of medical treatment right now for anything.
To be
you
honest
go in
with
for
you,
a cold, you come out with a $5,000 bill. So if it's going to, they may feel as though, if it is going to help them with the cost to go more unconventional, as Dick Gregory did, as we know, he had his cancer scare, he did his personal treatment the natural way, and cancer was in remission for quite some time. You know, so it can work for some, and for others it may not.
Although
but I think
I'm going to argue the cost thing, because I think most conventional therapies are covered medically with your medical insurance.
Or nothing is 100%.
Well, of
Well,
course
not necessarily 100%, but I'm just telling you, non-conventional ways, they're not even on the list.
Taking the all-natural way, though, that's what I mean. Taking natural herbs and remedies versus going to a doctor that way. Insurance can't even touch that. Don't even try that, boo-boo. Don't even try that.
No, well, that's what she's saying. Yeah, is that like the insurance not even going to look at natural remedies because
it's so cheap, you don't need insurance.
But I'll tell you that the challenge with that is so one, non-conventional alternative therapies tend to be very, very expensive.
Yeah.
And the people that tend to choose these tend to be in a couple spectrums. One, a lot of well-educated, very wealthy people tend to choose alternative therapies, and a lot of studies kind of look at this. You know, there aren't too many, and one of the challenges with alternative therapies is that it's not as well studied and it's not as vetted in the same way that you can see a lot of the medicines that come out in general, but chemotherapy agents, cancer therapies, surgeries, radiation therapies, these things are studied for long periods of time and well-designed studies. And every time something is studied and it's not well designed, we criticize them excessively with a lot of impunity. We're very medicine is a very skeptical field of science. And so alternative medicine is not looked at and studied with the same skepticism. And so a lot of those things are, are looked at, and the studies in those fields are not looked at with the same skepticism. And so people hold on to studies that may see things the way they want to be seen, and they charge a lot of money for it. And with herbs and things of that nature, unfortunately, there's nothing that's shown to be as beneficial. And people with low risk, low volume disease sometimes can be monitored with active surveillance. Like, for example, low volume, low risk prostate cancer. You can do active surveillance in 10, 15 years, may not have any kind of problem with it. And that's the danger with this, is that for cancer, if you bet wrong, on the flip side of things, you may not have the benefit where conventional therapies, where it could have been curative, may not be curative in the long run.
Well, speaking of being skeptical, obviously this week we had the eclipse, so we wanted to move on to one of the most talked about medical concerns this week, eye damage following the solar eclipse on Monday. Now, for those who may have looked directly into the sun, even though you were told a million times not to, what signs of potential harm should people be watching for if they did look into the sun? So
it's an amazing thing. So with eye damage, you can even have superficial damage to kind of the most superficial lining of your cornea, which is epithelium. It's like the skin of the most front layer of your eye is the cornea, and that's almost like snow blindness, which lasts a few days, and you feel like you have a little scratch on your eye. But the thing that's most concerning is the retina. And the way this works, which is fairly interesting, is fairly similar if you look straight at the eye, at the sun. It's damage from direct exposure to sunlight. So when we go outside and look directly in the sun, we have a reflex where we won't be able to do that for very long because it's uncomfortable. And usually our pupils constrict to allow that sunlight not to get into our eye and damage our retina. When the moon was covering the sun, everything gets dark. Now here in Jacksonville, we had a lot of cloud and
I didn't notice much of a difference.
But places that it would get dark. So when that would happen, our pupils would not constrict, so it would be dark. And when the moon's covering the sun, like the picture that we see here, it wouldn't be as much of a problem. But as soon as that moon moves a bit and that bright shining of the sunlight,
we don't have to worry about that here in Jacksonville, do we?
Well, a lot of people took some trips to Georgia to see the full, to see the totality.
So that first moment when that bright sunlight comes in there and your pupils are wide open, that moment of sunlight that gets into your eye may be very, very dangerous. And if you're looking up without the sunglasses or proper protection, that exposure to your retina could potentially damage. And even the most small amount of sunlight, direct sunlight into your retina, could potentially cause damage that could be irreversible.
So if someone did not pay attention, did not listen, and looked up at it, would they know by now if they had any type of damage?
So you could potentially know things. So one, if people had any kind of damage, you may notice things like headaches, you may notice nausea. So changes in vision can cause that. The other thing is if you have blurry vision, especially if it's in the center part of your field. Your retina is responsible for that central visual acuity, and people may notice that. So and if you have any kind of changes, go talk to an ophthalmologist.
So they haven't had any symptoms as of now, they should be good to go.
They should be okay, but it could show. Wavy vision, distorted vision. If you have sensitivity to light, make sure. And if you're seeing spots, obviously if you have pain in your eyes or anything of that nature, go see a doctor.
And if they did suffer damage, is there anything that can be done for it?
So unfortunately, if you start noticing what's called solar retinopathy, as of now, there's no cure or anything. It can be monitored and people may recover. But if you have anything, see an ophthalmologist so that you can begin the process of recovery.
And stop looking into the sun.
Absolutely.
Stop doing that.
Obey.
All right, thank you so much, Dr. Kasraeian, as always. And this medical contribution was furnished by Kasraeian Urology. You can hear more from Dr. Kasraeian on his weekend radio show, The Conversation, Saturdays on WOKV from 5 to 6 p.m. We'll be right back.